Hello, good afternoon, everybody. Thank you all for joining us. On behalf of the Congressional Hispanic Caucus Institute, CHCI, welcome to today's webinar, LGBTQ Latinxes and COVID-19. Before we begin, I just want to introduce myself. My name is Mario Enriquez, and I am the Director of Domestic Programs at the LGBTQ Victory Institute, an organization dedicated to training LGBTQ leaders from around the world to get to elected office at every level of government. I'm also a proud CHCI alumnus, where I was the Higher Education Graduate Fellow in the 2016-2017 academic year. CHCI is a nonprofit and nonpartisan 501c3 organization, providing leadership development programs and educational services to students and young emerging Latino leaders. Our alumni network is over 4,000 individuals strong, and it's because of the leadership component of CHCI and our alumni and our participants, it was why this conversation came about. We are in unprecedented times in 2020 with the global pandemic impacting the entire world. Our alumni approached CHCI and said, this conversation is needed now more than ever. Particularly Black and brown folks are negatively being impacted. But in particular, we want to talk about the LGBTQ community, considering that we are now closing out Pride Month. It has been an interesting and exciting last couple of weeks, and we're so happy to have this conversation happen with three amazing friends of mine that I know very well, who are thought leaders, subject matter experts in their own right, within not just the Latino community, but also the LGBTQ community. I'm also honored to bring on these panelists because they also have their inside perspective of the challenges that affect our communities, but also talk about the solutions through activism taking place throughout the country, and also be curious to see in their roles as leaders, but also how allies, for those that are watching, can play a more inclusive and equitable society for each and every one of us. A few logistical reminders. This session will be recorded and broadcast via Facebook Live, and registered participants will receive a link via email. We'll also have a Q&A at the end of the hour, because again, we really want to maximize the last 15 minutes to hear from you all, to see what's going on the ground and all over the world. Please submit your questions using the Q&A function located in the bottom toolbar of your Zoom screen, and we'll try to address as many questions as time permits. And now, I'd like to introduce you to our three amazing panelists. First, I have the honor of introducing Representative Jessica A. Gonzalez, who proudly represents the 104th District of the Texas House of Representatives. She's a trailblazer in her own right. She was a 2011 Law Graduate Fellow for CHCI, and she's also the current Vice Chair of the Texas House LGBT Caucus, one of 5 members currently representing the Texas House LGBTQ membership. Welcome, Representative Gonzalez.
Hi, thank you for having me.
Our second panelist is from an organization I know very well. I'd like to introduce you all to Alberto Gonzalez. He is currently the Senior Strategist for Health Policy at Unidos US, the nation's largest Latino civil rights and advocacy organization, formerly known as National Council of La Raza. He is also a summer of CHCI alum, where he participated in the summer internship in 2005. He's also, on top of his health policy expertise, he receives his MPP, Master's in Public Policy, at the Harvard Kennedy School of Government. Welcome, Alberto.
Thank you, Mario.
And last, but certainly not least, a fan favorite, a trailblazer in her own right, one of our madrinas in the LGBTQ community. I'm so proud to welcome Bambi Salcedo, the current president and CEO of the Trans Latina Coalition, based in Los Angeles. She's well known throughout the world, having spoken at various national conferences, giving keynote addresses, as well as been invited to the White House as a special guest. Welcome, Bambi. It's great to see you again.
Muchas gracias por la invitación.
Thank you so much. So again, now that we're all here, you all are on the ground doing so much important and amazing work that's critical to our communities. And I really just want to get started. You know, again, all three of you have amazing biographies, and I encourage all of you watching to go to our CHCI website to learn more about these amazing individuals. But to really start off this question, it's kind of a great combination starter is to really dive into what are the specific challenges that the LGBTQ community has had to overcome during the COVID-19 pandemic and continues to combat. But in particular, how does that tie into the work that you all are doing, whether it's nationally at Unidos, at the state level from the representative, or on the ground from Bambi? If we can start off with Alberto, we'd love to hear from each and every one of you.
Sure, Mario. Thank you so much for the invitation, and thank you to the Congressional Hispanic Caucus Institute for organizing this important event as we both recognize Pride Month and the health and economic challenges that our communities are continuing to face during this unprecedented crisis. And I hope everyone is staying safe out there. Unidos US is glad to be participating in today's webinar to raise awareness about COVID's impact on LGBTQ Latinx health, and to identify what roles policymakers, advocates, community members can play to address the health disparities that are being magnified by today's pandemic. And as many of you know, Unidos US is the nation's largest Latino civil rights and advocacy organization that is doing important work in the areas of education, immigration, economic empowerment, and housing and health. And by leveraging our unique assets of policy programs and our affiliate network, we seek to build a stronger America by advocating for policies that give more people the tools they need to be healthy and economically secure. And that includes access to affordable quality health coverage and care. And we have a number of affiliates, including the Wall Las Memorias, Altamed, Community Housing Works, who are service providers and voices for the LGBTQ constituencies across a range of issues, including health. And since our establishment in 1968, Unidos US has strived to create a welcoming and inclusive space for Latinx people of all backgrounds. We were among the first civil rights organizations to support the Equality Act when it was first introduced in Congress in 2015. And we're continuing to champion that important piece of legislation together with our partners in the civil rights and advocacy space. And just a few factoids here. Today, an estimated 6.1% of Latinx adults identify as LGBTQ, and that's more than white, Black, and Asian Americans. And among Latino youth, the rate is much higher, as more than 1 in 5 Latino millennials between the ages of 18 and 34 identify as LGBTQ. And so to answer your question, Mario, this pandemic has exposed long-standing health inequities that have impacted the LGBTQ community and the Latinx community as well. Latinos overall continue to have the highest uninsured rates than any other major racial or ethnic group. Nearly 1 in 5 Latinos today don't have health coverage. And according to the Human Rights Campaign Foundation, 1 in 5 LGBTQ adults have not seen a doctor when needed because they could not afford it. Black, Latinx, LGBTQ adults are most likely to have avoided going to the doctor because of high healthcare costs. This means that Latinx communities, including those who are LGBTQ, are at particular risk of falling ill and being unable to access testing and treatment that they need and that will be required to protect the public health of our nation. We know that Latinx communities are on the front lines making vital contributions to the nation's ability to function, such as providing healthcare, helping put food on the table, and delivering other essential health services. But at the same time, the available data we have shows that they are among some of the most vulnerable to getting sick and dying. Nationwide, 16% of COVID-related deaths are among Latinos, but recent data shows that it could be as high as 27%. And of the 1.3 million COVID cases reported to the CDC between January 22nd to May 30th, 1 in 3 are Latino. And as we follow preventative guidelines to reduce the spread of COVID-19, our communities are experiencing social and emotional implications from this pandemic as well. And one of the major challenges that we are facing to measure the extent to which COVID is impacting our communities is the limited data that's being reported on race, ethnicity, sexual orientation, and gender identity of individuals infected with COVID-19. We yet don't know the rates of COVID-19 in the LGBTQ community, which is troubling given the risk factors mentioned in terms of poverty and limited access to healthcare. And one meaningful way that policymakers can take to strengthen data collection, in addition to advancing bold policy solutions that are responsive to our immediate healthcare needs, is to support the Health Equity and Accountability Act of 2020, or HIA. HIA is the only legislation that directly addresses the intersections of health disparities and immigration status, age, disability, sexual orientation, gender identity and expression, language access, and socioeconomic status. Policies like HIA that promote culturally competent and linguistically appropriate healthcare, and that includes mental and behavioral healthcare, are crucial for Latinx communities who continue to face health disparities and psychological distress at this time. We're proud to have partnered with Congressman Garcia's office and the Congressional Hispanic Caucus to lead the development of this legislation this Congress. And just quickly, I'll just mention a few of the many ways that HIA could bring immediate relief to the Latinx and LGBTQ populations. It would expand access to health insurance for all. It would remove participation barriers for our community to access the safety net. It makes needed investments to enhance culturally responsive and linguistically appropriate healthcare services. It invests in mental health, and it strengthens data collection, which is so critical right now. And all these provisions would help address the emerging and growing needs that our communities need and that are now reflected in congressional relief packages. So we believe that all LGBTQ and Latinx individuals deserve access to immediate COVID testing treatment, regardless of immigration status. So again, that's just one immediate way that we can all be supportive to ensure that our community members are being taken care of during this tough time, Mario.
Absolutely. No, thank you for that. And, thank you for everyone for submitting questions. We'll definitely follow up with the specifics regarding the data collection that you were talking about, Alberto. Representative Gonzalez, love to hear from you on just your work as a legislator, what you're seeing in Texas and how folks are navigating COVID-19.
Thank you. And just kind of mirroring some of what Alberto said, I mean, the failure of federal officials to consistently collect data and report data on sexual orientation and gender identity makes it pretty much impossible to really know the health and economic toll on the LGBTQ community and the people of color in the LGBTQ community during this time. What we do know, though, is that there is a disproportionate impact on our trans community. Just last week, HRC, in partnership with some other organizations, released data that LGBTQ people are disproportionately impacted economically by the pandemic, and shows that transgendered people, especially of color, are more likely to become unemployed due to the virus, are far more likely to have their work hours reduced, and more likely to have asked for delays in paying their rent or their bills. For our transgendered people of color, the systemic barriers in employment, housing, healthcare compound, the hardship faced by so many during this pandemic. The impact of COVID-19 on LGBTQ people, particularly transgendered people of color, reinforces that we can't protect public health without equality for everyone. 40% of LGBTQ people work in industries that are disproportionately affected by COVID-19. So this means that more of our community is feeling the financial hardship of COVID-19 and need assistance from their government or from whatever resources that are available. There are many organizations providing help directly to our community, but we were not prepared for this a pandemic of this magnitude. Just to give you like an example, 54% of transgendered people and 58% of transgender folks of color have had their work hours reduced due to COVID-19, compared to 30% of LGBTQ people and 23% of the general population. And so, I think overall, they are more likely to have become unemployed, more likely to have their work hours cut, and more likely to feel their personal finances in worse shape, and more likely to be taking steps to actively prepare for the virus. And in reality, it's that the toxic impact of transphobia and racism that continues to be present. This data shows that reflects a broader reality facing the transgender people of color, especially Black transgendered women. I think one thing that I'm working on, and I think that I think that Texas is one of only 27 states that does not have a comprehensive non-discrimination law. That is one thing that I'm going to be filing next session to make sure that the LGBTQ community is not being discriminated against in housing, employment, and in public spaces.
Absolutely. No, thank you so much for your leadership, Representative. And we definitely, you continue to be a champion. So we look forward to that legislation, and we know that you'll fight hard for us. Thank you. Bambi, I'd love to turn it over to you again. You do such amazing work, and just love. I know we haven't talked in a couple of months, but I know you've been busy, and love to just see how's everything in Los Angeles, the work that you're doing with the Trans Latina Coalition, and just your thoughts on our community.
Yeah, well, primero que nada quiero darle gracias a mi poder superior por darme la oportunidad de estar aquí con ustedes, y también quiero honrar la presencia de las personas que nos acompañan hoy en día. I know that it was probably hard for some of you to understand what I just said, but usually or always before I speak, I like to honor my higher power for giving me the opportunity to be here one more day. Also, I want to honor the people who are joining us today. Thank you for your presence here in this virtual setting. And also, I'm so incredibly honored that I get to share stage with incredible and amazing, not just friends, but individuals who I admire, and I definitely support the work that they're doing. So, I think, thank you for bringing that question, because I think, many of us don't necessarily think about, where we are as a community. And I am definitely going to speak on the transgender perspective, right? We as a national advocacy organization that has representation in 10 different states are seeing the ramifications of COVID-19, right? We do have the Center for Violence Prevention and Transgender Wellness, where it's the service provision arm to our organization. And what we've seen since this pandemic started is that, well, first, we never closed our center, right? Because we thought that it was important for us to even, provide food to people, the people that we serve. We are the only trans-led organization that is actually providing direct and life-saving services to our community here in Los Angeles. And before the pandemic, we were, giving lunch every day. And so, we knew that because of the pandemic, many of our community members, particularly those who are homeless, were not even going to have access to food. And so we made that decision to continue to have our doors open, to, even if it was just to get food, to continue to support our community. But what has happened is that, and not just in Los Angeles, but across the United States, particularly with trans people, is that here at our center in LA, our calls have increased up to 500% from trans people in the community calling, being scared of the situation, to not knowing how they're going to pay for the rent, those who did have the privilege to have an apartment or a place to stay, and those who did have employment lost their employment. And the majority of the employment that trans people have are in the service industry, right? The majority do like impersonations at bars or clubs and all of those things. Many also do work in the beauty industry, like cutting hair and like beauty salons and that kind of stuff. And some also work, at restaurants and like janitorial work, like those type of things. And all of them lost their jobs, right? And so what I think it's important for us to understand is where trans people was situated in 2020 before COVID-19. And obviously all of these things that were named, that, discrimination while trying to access employment, healthcare access, housing access, all of those things we already knew, that those were, experiences that we were having, right? Like having access to basic things that we need. That's actually why our organization decided to move into doing service provision. And so what we have to understand is that, this pandemic has set the trans community even further behind, right? So just giving some context, if we compare where the trans community is versus the gay and lesbian community within our society, right? The trans community is about 40 years behind, legislatively, academically, economically, right? And so with this global pandemic that we're experiencing, we know that our community is going to be even further set behind. So that is important for us to recognize and understand. Um, and obviously, you know, when some of us, like I have friends who have actually perished because of the pandemic, right? Um, in fact, Lorena Borjas, who was one of our board members in New York, she died because of COVID-19. And we know that we experience harsh experiences when we are trying to access healthcare. And that is why we are suing the Trump administration, because, you know, because of the rule that the Trump administration put for us to like really give permission to healthcare providers to discriminate against the LGBTQ community. So we are part of this lawsuit that we are putting forth, you know, to really stand up for our rights.
No, absolutely. And sorry, my condolences, Bambi, for your loss. No, definitely. And I think when we're really thinking about the ongoing challenges, you know, you talked about specifically with the transgender community being affected, even more within the LGBTQ community, and the challenges of the economy and healthcare. This really goes well into the next question. And I'd love to hear from Alberto first, especially when we talk about healthcare. And, you know, with the varying resources throughout the United States, we know that it's not equal, right? When in terms of the resources, and it could be based on the zip code that you live in, right? And how can LGBTQ community, especially Latinx and other marginalized communities, seek gender affirming and culturally competent healthcare? And let's just start off with Alberto, just in terms of the national framework of what you see and what you think.
Yeah, thanks for raising that question, Mario. You know, the lawsuit that Bambi raised, so that's you know, the administration has repeatedly tried to attack our healthcare system, and, you know, specifically the Affordable Care Act that has provided an extended health coverage to over 20 million Americans across the country. And it's important to note that with the passage and implementation of the Affordable Care Act, it also included civil rights protections in healthcare settings. So that's under what is Section 1557 of the Affordable Care Act. So I'll get into more detail about that. You know, but as we know that there are challenges from the advocacy community that are being impacted by these actions by the administration. You know, it's important to note that the Affordable Care Act remains the law of the land, and we continue to have civil rights protections afforded to us, you know, in any healthcare institution that receives federal funding. So, you know, all LGBTQ people have the right to receive healthcare and access services, especially during this public health crisis. You know, medical providers and facilities cannot discriminate against you because of your sexual orientation or gender identity. You know, and this was included in what I mentioned before, Section 1557 of the Affordable Care Act, which prohibited discrimination on the basis of race, ethnicity, sexual orientation, gender identity, and preferred language in the healthcare system. So this means, for example, that, you know, public hospitals are prohibited from denying Latinx populations who are LGBTQ or limited English proficient from receiving healthcare services due to their background. And, you know, just a couple of weeks ago, the Trump administration finalized a rule that would roll back these civil rights protections, a move that's currently being challenged by a number of civil rights groups. And so Unidos US and our allies in this space, we continue to advocate to protect the ACA's civil rights protections to ensure that it covers all and it addresses the needs of all who need access to culturally competent care, to ensure that they receive it. And again, this is just another reason why, you know, it's so critical right now that we call on policymakers to pass inclusive policies, you know, that invest in our healthcare systems, including community-based organizations, clinics, other trusted providers that are delivering care to populations that are most at risk of COVID, including Latino LGBT populations. And one other thing I wanted to raise is related to healthcare. Right now, the Trump administration and 18 states are challenging the Affordable Care Act in the courts. And so this has serious implications for the Latino community across the country. It's estimated that about 5.4 million Latinos could lose their health coverage if this lawsuit is successful. This lawsuit, California versus Texas, is currently pending before the Supreme Court. So right now it's important that we continue to raise awareness with our policymakers to let them know about what the implications this lawsuit would have on our community members. And again, this lawsuit, if successful, will reverse coverage gains that we've seen in the Latino community. It would, again, undo many of the protections that were in place that impact LGBT populations. And so just want to reiterate, this concerning response that we're getting from this administration that's been, repeatedly attacking the Latino and LGBTQ population. So that's something I'd share on about the work we're doing to protect the Affordable Care Act.
Great, oh, thank you. And Representative Gonzalez, love to hear from you on your thoughts on the healthcare issue, especially with COVID-19, but in particular, how you see it with your constituents.
I mean, well, unfortunately, with things like the Trump administration's removal of non-discrimination protections in healthcare for the LGBTQ community, LGBTQ people don't feel welcome at every doctor's office. 1 in 5 do not visit a doctor out of fear of discrimination, or they just don't have the resources available to see a doctor. Some LGBTQ folks don't have the options for doctors where they live due to their health insurance that they have in place, or just no health insurance at all. So we really need federal legislation that needs to be considered, like the Equality Act, to ensure that LGBTQ people are protected and that they feel safe during their doctor visits. And I would recommend, when possible, in looking for a healthcare provider, to try to Google your doctor beforehand and see if any LGBTQ folks have said they are supportive or not. During the pandemic, telehealth and telemedicine have become more popular and expanding choices. An option would be to see an affirming telehealth doctor. The HRC, if you go to the HRC website, they have really good resources that are COVID related and have a ton of information. But telemedicine visits are not restricted to existing patient-provider relationships, which is useful if someone is starting up a search for a new healthcare provider. Some plans, some states allow care with out-of-state providers, which is helpful if one lives in a community where they don't feel safe to be out as an LGBTQ person in a local clinic, or where access to LGBTQ affirming healthcare is limited. So telemedicine allows LGBTQ folks to access experts who are affirming and will be welcoming. So I definitely encourage folks to take advantage of that if they are looking for a healthcare provider where they feel comfortable going to visit them. One thing that we're definitely going to do next session. Right now Texas, the legislature is not in session, so we start back up in January. Along with the bill that I'm planning on filing, one of my colleagues, who is also one of the founding members of the LGBTQ caucus, is planning on filing some legislation addressing this issue to make sure, she does a lot of work in, healthcare and insurance. And so she's planning on filing a piece of legislation here that will address that. And so that doctors, healthcare providers can't discriminate based on sexual orientation or gender identity. And so that's something that, our caucus will definitely be supporting, and I will be supporting. I definitely encourage folks to support legislation like that in your state if it doesn't exist.
Great, no, absolutely. And this really goes well with my next question. Bambi, I'd love to hear from you on not just this question, but it ties in so well with what you were talking about earlier with just the unique challenges that the transgender community faces, but especially I'd love to hear your thoughts on the challenges of healthcare, but also what can we do within the LGBTQ community as allies to best support the transgender community? So first, really thinking about the challenges and how we can best support the transgender community when it comes to health, but also how can we better support the overall community and be effective allies? Oh, Bambi, I think you're on mute.
I'm sorry.
No worries. Oh wait, Dami, sorry, I think you're on mute again.
I think
Oh,
somebody's muting me. And anyways, um, so I think what is important for us to also understand, right, that that our healthcare, the trans people's healthcare, it's not really there, right? So what we really need to do is, really think about how is it that we are going to build a healthy trans community and healthy trans people, right? Um, we know that trans women specifically, right? We are the ones who have the highest incidence of HIV, for instance, right? We know that even in the state of California, right? We live in a very progressive state, and people continue to receive discrimination while trying to access healthcare, right? We get discriminated simply because of who we are, period. I know that Representative Gonzalez was saying that, LGBTQ people, like have challenges accessing healthcare, right? But a gay man can not necessarily, if a gay man is not super effeminate, then, they can go through the radar, if you will, right? Or a lesbian woman, for instance, right? For us, when we present to a clinic, we come as who we are, right? We can't really pretend that we are not trans because we are visibly trans, right? Um, and so that in itself, it's prone for us to be discriminated. And so that continues to happen. And just to give you an example, right, here in the metropolis, in Los Angeles, for instance, right, there's only 2 clinics that provide services for trans people, right? 2 clinics in a city that is more than 10 million, right? They said that in the state of California, there's about close to 220,000 trans people that live in the state of California. The majority are in LA and in San Francisco. And so those clinics have waiting lists to see trans people, right? And so there needs to be um, a lot of culture transformation and capacity building support that needs to happen, right? And it needs to start from like the beginning, right? In medical school, they don't teach people about trans issues. I think they have a curriculum for the whole 5 years, right? Of like 2 hours to teach on LGBT people, right? And so the trans component is like 5 minutes, right? And so people don't know how to treat us. People don't know how to, see us, despite the fact that they actually made a pledge or a commitment, right, to treat everyone, right? And a lot of this has to do with most hospitals are religious based, right? And so that has a lot to do with it. So there's definitely structure changes that need to happen in order for, one, people understand who we are as people, and two, people in service care and the healthcare industry need to see us as people, right? Not see us as what they believe or what they have been programmed to believe about who we are as people, right? There's a really great documentary right now on Netflix that is called Disclosure, in which, it talks about, for, I'm gonna say centuries, right? But from the early beginnings of film or the early beginnings of, us being portrayed in the media, right? That influence a lot how people think of us, right? And if you add the religious component, if you add the political component to it, and if you add all of those things, the society that we live in has always said that we are not supposed to exist, right? And all of this came to be because of the colonization, right? That you know, the colonizers wanted to change, you know, indigenous customs and all of those things, right? And so that's how, again, when I mentioned at the beginning, right, where we are positioned in 2020 as trans people, and now even further with this global pandemic, where we are going to be situated. And for many of us, accessing healthcare is not an option. One, because they're not going to treat us because of who we are, especially if hospitals are saturated, if some of us are, you know, infected with the virus and need to have access to healthcare to save our lives, they're not going to prioritize us, right? And they're going to like let us die. And that's what the system has been created to do, to really erase and disappear our lives and our existence. So, you know, your question about like what can allies do? I mean, everything needs to be transformed. Everything needs to be transformed. And so I think there's definitely this separation between what people say and what people do, right? So people say that they're with it and they understand and they're gonna do, but when it comes down to it, we are never a priority. And so this is really a call to action to legislators and policymakers really to transform the system of how it is. And I think we also need to like really not care what others are going to think of us, because that's also what influences the way we think and the way we do things. And we just need to like really believe, if we believe in social justice and human rights and civil rights, then we also need to understand that, you know, the United Nations said that healthcare is a human right. Yet when it comes to certain people, that human part of it is completely erased. So we need to really figure out what is it that we're going to do in order to create those changes that need to happen structurally.
No, absolutely. No, thank you, Bambi. I was taking notes down. Just you said so many really great highlights in terms of first, definitely the Netflix documentary Disclosure, folks. Please definitely check that out. And a little bit more in terms of what we're talking about, that call to action. I really appreciate that, you know, especially within, you know, a call to action to policymakers to really think of the entire global community, including trans people, and for the transgender community to be seen, and even a call to action within the LGBTQ community. You know, that's something that even now more than ever, we have to really stand up for all of our brothers and sisters, especially if you're a cis gay white man. Speak up for your trans sister, your trans brothers. Really, it takes all of us also within the community. So thank you for highlighting that important thing, that part that we should all be doing and continue to do. And obviously we have organizations like the Trans Latina Coalition, our legislators such as Representative Gonzalez, and the great work that Alberto is doing at Unidos US to really bring this issue at the forefront. And it also made me think of this next question, particularly for Representative Gonzalez. When Bambi was talking about just the challenges that the transgender community faces with access to healthcare, when I was thinking of access and just the challenges within LGBTQ Latinx folks, but in particular with immigration, you know, for you being at a border state, when we think of the immigration status, how has that heightened the negative effects of COVID-19?
Sorry, I was trying to unmute myself. Yeah, I mean, there are roughly like 36,000 DACA and roughly 7,500 or 75,000 Dreamer recipients that are part of the LGBTQ community. You know, we did see, you know, in Texas, there were, you know, lots of folks that were being detained. We saw lots of folks that are being, I don't know the exact number right now, but, you know, we were, you know, as a person in the legislature and a member of the Mexican American Legislative Caucus, you know, we were, you know, constantly, you know, writing letters, trying to make, you know, making phone calls to have them, you know, have the detention centers not keep these folks detained if they're not, you know, if they're not there because they're you know, violent people, or they're not there because they committed a crime, because that was furthering, more folks were getting infected. But, we're at a time when our federal administration is constantly attacking, our immigrant community, how can they feel safe, in getting federal resources, for COVID-19. My office makes it a priority to ask, for food distribution sites and testing sites, if they ask for identification before we post it on social media, so people are aware what resources they have available for them, because that is a problem here. My district, I don't know for certain, like the amount of people who are documented versus undocumented, but 80% of my district is Latino. And so it has impacted, my district a lot. And so we've seen a lot of, like I said, food distribution, programs, just making sure that, my constituents know of the resources, and even just, folks who are immigrants that, have their own small businesses, that a lot of them have had to, permanently close their doors. It's just so helping them navigate, what resources are available for them and their family and their businesses. That's what we've kind of been focusing on right now, since we're limited to what we can physically do. Yeah.
Absolutely. No, thank you. And Alberto, would love to hear your thoughts on just how Unidos US, but also the work that you're doing specifically in terms of the immigration community around COVID-19.
Yeah, and thanks for raising those points, Representative Gonzalez. The other point I wanted to also flag is around food security. We talked a lot about the challenge of the large uninsured rates among Latino populations, but there's some data coming in to show that Latinos, particularly Latino families with children, are becoming increasingly more food insecure because of the pandemic. So, that's another troubling data point that we're monitoring, and we're hoping that in future relief packages that we see, that they're inclusive to ensure that all community members have access to food, that there aren't any barriers keeping families, including immigrant families, from being able to access these important resources. Before the pandemic hit, many Latinos were already fearful, and particularly Latinos from mixed status families were very fearful of seeking medical care, for fear that it would trigger them as a public charge and impact their immigrant family members. The administration's anti-immigrant agenda that was reflected in this public charge rule, and by their increased enforcement across the country, has created a chilling effect that has only been strengthened during this pandemic. And it's pushed Latinx families away from seeking critical healthcare, nutrition, and economic supports when they need it most. Manette Health released an analysis that showed that as many as 26 million people and their families, could be dissuaded from using public health benefits or public benefits overall because of this public charge rule change. And, months after this public charge rule was published, 1 in 7 adults in immigrant households reported that they or a family member had declined to participate in a government benefit program for fear of risking their immigration status. And just for context, this is the rule from the administration that would essentially punish, low-income immigrant families for using, life-saving, altering resources, public benefits for themselves, for their loved ones, and use that to impact their status, their immigration status, to apply for entry to the U.S. Through a green card. And so again, we know many of you out there have been monitoring this issue, but it's been a major priority for our organization. But again, there are some intersections there between immigration status and health outcomes. And so, we're continuing to monitor this concerning effort by the administration to continue to attack the Latino community, the immigrant populations that we serve. And it's also created the administration's mass deportation agenda has also created this, hostile and fearful environment for, LGBTQ immigrants in particular. In addition to the threat of deportation, we're seeing that, LGBTQ LGBTQ immigrants are continuing to face high rates of violence. The Center for American Progress reported that LGBTQ undocumented immigrants accounted for 70% of anti-LGBTQ hate violence survivors back in 2018. And the National Center for Trans Equality showed that, in one of their reports, showed that nearly 1 in 4 trans undocumented immigrants reported being physically attacked in the past year. And now there's evidence to show that immigrants are afraid to access medical treatment for COVID and necessary economic supports because of public charge. So again, the situation was worse before the pandemic, but it's only getting worse for many communities across the country. And again, that's why it's so critical now that we advocate for inclusive policies that ensure that everyone who needs testing, who needs food and nutritious supports to help put food on the table, that they're able to access it and receive it. We need more resources to ensure our community members are aware about these available services and to access these health and nutrition programs to address their immediate needs, especially during the pandemic. And I'll just mention what happened yesterday. The House of Representatives passed legislation to strengthen the Affordable Care Act. And it included a provision that would ensure that over 200,000 Dreamers that serve as essential workers during this pandemic have equal access to quality, affordable healthcare. So we need to continue to build on these proposals to expand coverage and increase investments into community-based organizations that serve as trusted messengers for all Latinx populations. And that would ensure that those who are most at risk of COVID, including the LGBT community and Latinx folks, can receive the care that they need right now.
Can I say something?
Yeah, please.
Yeah, thanks. You know, the truth is that, you know, there's a lot of work that needs to be done, right? And I think it's important that we learn about these policies, you know, but the reality is that, you know, we work with people who are in immigration detention. We support trans women who are getting released from immigration detention. And like right now we have a Cali to Free a campaign to free Cali. And Kelly is a young trans woman who just turned 23 in immigration detention, has been in immigration detention for 3 years, right? And so, you know, and what's happened also, particularly to Kelly, is that, you know, they were fumigating inside the in the pods, and the chemicals are so strong that she got sick from it. She was bleeding from her nose. She had a rash all over her body, and her body was burning, you know, and like people don't hear about these things, right? And I think what really gets me is that, you know, there's amazing and great organizations that could be doing more, and they don't do it. You know, there's organizations that are powerful, national organizations that could really move legislators, that could move people who have power, and they don't, you know. And so that to me, that's a disgrace really to people. You know, we need to learn to say what we mean and mean what we say, right? Because performative politics are great, but it only serves a certain kind of people, right? They're people who are really suffering, like really suffering, right? And we don't, you really need to know what the lives of these people are, right? We get so separated from the lives of people, you know, and so we really need to be intentional about the work that needs to happen, right? the Trump administration just also, released this sort of this the oh my god, it's just sorry. They just the asylum the requirements for people asking for asylum, right? We did a study in 2012 specifically about trans women who are immigrant and who live in the United States that people cannot have access to in our website, in which it states that 99% of trans women who come to this country come fleeing from violence that they experience in their country. There's almost 400 trans people, and the vast majority trans women, who are murdered around the world. And they flee their countries because of their lives are every single day in jeopardy. That's not to say that it's different in the United States, but trans women leave their countries hoping to achieve or to come to get the American dream, and they come to get the American nightmare. And so we really need to, like, again, say what we mean and mean what we say, and be intentional about the work that needs to be done, and do it, and move whatever influences. And yes, if you're not going to do the work, right, then support those organizations who are doing the work, because it's a lot of work, and people need to be supported.
Absolutely. No, thank you. Thank you, Bambi, for who you are, and thank you for your vulnerability. I couldn't help but read comments in the Zoom chat of just how many people were saying thank you for your strength and for all that you do. I know I personally am one of those folks. So thank you for sharing. And you're right. In terms of we don't have time for the performative politics. It's really about action. So thank you for all that you do. And we have 5 minutes left before we go on to our Q&A. We have so many fantastic questions from our audience who are watching. But before, I'd love to just hear from our panelists within just the next 5 minutes of how do we learn about just the current legislation impacting Latinx folks, the LGBTQ community? How can we be observant of what's going on? And also, where can we access these resources to help people, whether you're in the Midwest or conservative part of the country or in progressive California? How can we find these resources, and how can we really be that community that Bambi was just talking about?
You want me to start?
Yeah, please.
So, we send commissary money to trans women who are in immigration detention. So we send about $30 a month. So if you want to adopt a trans, you can donate $30 a month to our organization. Please, become a recurring donor. If you cannot do $30, even if you can do 10, 5, if you can do $1 million, that's even better, right? But we are actually, every year we do a fundraiser that is called Garras. It's an acronym. It's groundbreaking activism, redirecting resources. What is it? Groundbreaking activism, redirecting resources and services. Something like that. Sorry, but this year, because of the pandemic, we're not going to be able to do our fashion show. It is a fashion show in which we highlight and uplift trans lives, right? And it's a contrast to Transgender Day of Remembrance, which is in November. And so because of the pandemic, we know that we're probably not going to be able to do it this year. Last year, the last 2 years, with the money that we have raised, we opened our Hope House. Hope is also an acronym. It's helping our people evolve. It's a transitional housing program. And so we don't know what's going to happen next year. We are trying to do a fundraiser online, but one idea that I thought is that we're starting sort of like an ambassador program. And so we're asking young and beautiful and well-intended people who wants to support our organization. If you can help us commit to raise $1,000, right, each, we hoping to get uh, 100 individuals who will commit into helping us raise $1,000 each so that we can continue our Hope House. So if you want to be part of that ambassadors program, we want to invite you to be part of that. And so please help us to donate, become a recurrent donor with whatever you can. We certainly appreciate that, especially now in these times.
Bambi. Representative Gonzalez, love to hear for your thoughts on just how do we access resources? How do we stay up to date with legislation?
I mean, I would say call your lawmakers at a federal, state, county, city, school board, and let them know where you stand, that you stand with the LGBTQ community, and that you want them to focus on non-discrimination measures or pro-equality measures, in their position in office. I would say at a state level, at least in Texas, there are organizations here like Equality Texas, that specifically focuses on Texas in trying to elect a pro-equality legislature, but then also has, they have their legislative agenda and priorities. They made the bill that I mentioned earlier, the comprehensive non-discrimination bill that I'm going to file. It's their top priority, and so I'm working really closely with them. HRC, which is a national organization, as most of you here, but they do have really great resources there. They keep their website up to date as far as any recent legislation in other states. Right now, Texas, we're not currently in session, so it's kind of on that end. It's we can't even file legislation until November. But if you're looking at some Texas resources too, the House LGBTQ Caucus, our Facebook page, our Twitter. My social media page, Jessica for Texas. I mean, we do post a lot and try to keep people up to date on what's going on in other states, because every state is in session at different times of the year. And Lambda Legal is also a very good resource to look to find out and just kind of stay up to date on any legislation that is going to be filed or that people are planning to file in their legislative session.
Absolutely. Thank you, Representative Gonzalez. And this just makes it just the right time for our Q&A. Thank you all for submitting so many great questions. We're just reviewing all of them and really want to open this Q&A actually with Alberto, if you don't mind. Many Latinx people within the LGBTQ community face a language barrier, which mentioned earlier can cause additional fear, especially when accessing medical care. What advice and or resources do you have or the work that you do within Unidos US for LGBTQ Latinx people living in, let's say, for example, in conservative rural towns? And also would love to hear from the representative.
Yeah, so I would definitely point folks to our website, unidosus.org. We have actually pages and materials in English and Spanish to raise awareness and education on COVID, how it's impacting the community, what preventive tactics to take to keep yourselves healthy. We have affiliates, over 300 affiliates across the country. And so if you go on our website, you can see which ones are based in your states. I know that we have 28, for example, in Texas alone. And there are a number of affiliates that are doing work focused on serving the LGBT Latinx community members. I mentioned a few earlier during my presentation, but those are other resources based in the community that could be helpful to reach and receive information. We work closely. We have a policy component. We have a programs component. We work with our affiliates across the country, and we're mindful to make sure that whatever information that's being communicated right now is is done in a bilingual fashion. We did a webinar a couple weeks ago focused on SNAP and food nutrition and how that's impacted the Latino population. And we had that in Spanish completely. And so that's on our website, it's recorded. We've been holding a series of webinars focused on COVID. So if you go to our website, you can check out different recordings to get some information. So I would direct folks to our website and be connected to affiliates across the country.
Representative Gonzalez?
Sure. Well, as I mentioned earlier, I'm a member of the Mexican American Legislative Caucus. And so our focus is, to talk about issues that affect our community. And so, now, we do work a lot on that and, disseminate information to our community as far as resources. So, my office definitely passes along that information to our constituents in the district to be able to access those resources. But I would say, one of the best ways to do that is to call your state representative. I mean, that's what they're there for. That's what our job is, if you have a question on how to apply for unemployment or, how to, get a hold of a state agency, we can connect you to whatever agency, or if you don't know who to connect with or you don't know who to call, I would definitely call your state rep's office because that's what we're here to do. We're here to serve our constituents and help you navigate a system that you may not understand, or because of language barriers, you don't know who to access, you don't know who to call. So I definitely would recommend that.
Absolutely, thank you. So next question is really thinking of from one of our folks who just submitted a question. In this election year, a lot of the conversations on voting have surrounded our presidential elections as they come in November. But how do you, anyone on the panel can speak to this, suggest that we speak to how much more the census and our local elections affect the communities in which we reside in, and how they may also potentially play a major influence on funding received to the local communities in question, where we feel burnout on these efforts?
Can I, hi, can you hear me?
Yep.
Okay. So I'm gonna speak a little bit to that, but before, I also want to let people know that here in the state of California, we're actually, for the first time in the history of the state of California, a translator organization, a coalition that we have formed across the state are doing budget advocacy. So we are asking the governor in really the legislation to allocate $100 million to support translator organizations across the state. We're also working on a bill that is Assembly Bill 2218, that is sponsored by Assemblymember Santiago, which is the Transgender Health and Equity Act, in which we are asking the government really to allocate $15 million to support trans people to build the infrastructure of our community and really become healthy individuals. And so there's some of the things that we are doing here in the state of California. I also want to invite folks to follow our social media so that you are aware of the efforts that we are doing, including the campaign to free Cali and all of this. So we have a campaign that is called Invest in Trans Lives, in which we are going to target not just the government, but also the private sector. And that you're definitely going to hear more about that. In this effort really is to help build the infrastructure that needs to happen in the trans community. So again, we invite you to participate and or to follow us on our social media on Instagram and Twitter and Facebook too, if you want. But the truth of the matter is that for our communities, many of our communities don't even trust, government, to be honest, right? Just because of how government functions, right? And so, but I am part of the national LGBTQ advisory council for Vice President Biden. And so, you know, it's definitely important that we participate in the election process, right? Especially because of the administration that we have now, and um, we cannot have another 4 years of this inhumane treatment that all of our communities continue to experience. Um, and so, you know, I think it's definitely important that we mobilize people to participate in, well, those who have the ability, right, to vote for someone who is currently in office right now. We actually need to get that person out of office. But also in their local elections, right, as Representative Gonzalez mentioned, right, we need to influence who makes decisions at the local level. Um, you know, from the school boards to the district attorneys to the council members to supervisors, all across. We need to be able to do that, and we also need to participate in making measures, or yeah, like making initiatives that are going to support our community to have a better quality of life, right? And we know that all of that takes money, but that's okay. We're going to figure it out how to make sure that we do that. But we also need our politicians that are put in office to really do what they say that they're going to do, not to forget once they get into office what they said that they're going to do. And in terms of the census, you know what I mean? Like we're not even counted. Like LGBTQ people are not even part of that. So it's important that I guess, we participate because resources are allocated based on that. And obviously also legislative representation is also part of that. Um, but we also need to think about like how we as a community, LGBTQ individuals, are going to be counted. And I know that it's going to be in the next 10 years, but we need to mobilize now so that we can figure it out in the next few years so that it is actually in the form of the next census count.
Absolutely. Thank you, Bambi. And you know, we have 5 minutes, and there's so many good questions, and we definitely want to capture one before we do our closing question. So thank you all so much for everything at this point. This last question, and again, we'd love to hear from anybody that you're drawn to. Someone asked, how and where are you all engaging the Latinx community around projection and internalization of anti-Blackness within Latinx community of all colors as it relates to all of this? How do we hold space for these conversations, both in English and in Spanish? And whoever is drawn to answer.
Yeah, I'll just add that, you know, Unidos US, we've been working closely with our partners in the civil rights space, especially with regards to the response to the outrage violence that we're seeing across the country, and all happening within the context of COVID-19. And so I think it's helped to make us have these conversations and make sure that we are, in strong solidarity with all of our siblings, from all backgrounds. And so, I think it's a good, an important and needed way to engage with partners and to stand in solidarity and recognize the diversity within our respective communities also. I mean, I'll mention that our organization changed its name, a few years back, given the diversity within the community across the country. And so, I think that what's been happening across the country is a wake-up call for the country, and for us to, think internally and be proactive and take action to defend the rights of all people, of all backgrounds. And, I think this is a time that we need to have these conversations, and but we need to stand in solidarity with all, all people that are being impacted by what's happening today.
And I'll add that, I think that the majority of folks on this, on this webinar or panel, have all been treated with indignity at some point in their life, whether it's because you're brown or you're a woman or you're LGBTQ, and this is long overdue. I mean, us having some kind of reform and addressing this issue, more folks don't need to die before, we decide that we got to do something about it. Here in as far as the legislator, we're looking to our Black caucus to take the lead on this. And really the best thing we can do is to stand in solidarity, with our, Black brothers and sisters, because, other communities experience, the same kind of, violence that, Black Americans, and I'm not saying that, I would understand what it is to be a Black man in America, but the best thing we can do is to stand together in solidarity. Unfortunately, we will see, acts of violence like this happen in, especially like in the trans community. Even just last year in Texas, there were several, trans women that were murdered just because people are just hateful. I make sure to stand up for the trans community, to be a voice for the trans community. Last session in the legislature, because we're tired of these. We're tired of the I'm sorry's and the candles, and so we want to actually change something. So I think that standing in solidarity, standing together, working together, that we can get some changes done, not only within the Black community but in other communities as well that are often discriminated against or victims of violence.
Thank you. Any last minute comments before we get to our last question?
I guess I can add a little bit to what has been said, and particularly some of the things that we are incorporating in our organization. We actually have scheduled an anti-Blackness trainings for our staff and all of us. We are opening opportunities of internship opportunities for young Black trans individuals, for them to also, be part of the work that we're all doing. But I think what is important is for us, the work that needs to happen, right? It's, we have to know, and I think all of us know and understand that racism has been constructed since the beginning of the colonization, right? When they first came here, right, they specifically, wanted to, they murder millions of Native American individuals, and then they brought individuals to this country to build the wealth, right, of this country. And so everything was built to really invisibilize us, invisibilize everyone, right? And so we need to really be intentional about the work that needs to happen to dismantle the structure that has been built for years, for centuries, right? And so it's going to definitely take a collective effort. So this is, this is not just a Black issue, although obviously it's one of the peoples who have gone through horrible experiences, and we can see it even more with their experiences with police brutality. But many of our communities have gone through that, and so even within ourselves, right, racism has been ingrained in us. We are taught to think that Indigenous people are less than. We are taught to think that Black people are less than, right? And so we certainly do have internalized racism that we need to really address, and we really need to really confront and do something about it, right? And the only way that we are going to change that is if we are individually and collectively do the work that needs to be done in order for us to change not just ourselves, but the structure that has been a racist structure that has been built to eliminate all of us.
Absolutely, and thank you for the person who submitted that question. Thank you for your responses. So we're a little over time now, but I just wanted to again, thank all of you, but I wanted to leave our audience with one last question in regards to, knowing that Congressional Hispanic Caucus Institute is a leadership organization dedicated to empowering young Latinx people. For the young people that are watching, what would be, in a quick, if a 30-second elevator pitch, or what would be your call to action for these young people? If you can start off with Alberto, and then the representative, and then with Bambi, please.
Thanks, Mario. I would say this. Number one, vote, get ready to vote this coming fall. We need change. We need to support champions that care about our issues that we've talked about today. We need, as Bambi mentioned, working or making sure we influence local politics, making sure that people that are elected or that we're voting for look like us, support policies that positively impact us. So that's one. Two is supporting the Health Equity and Accountability Act, HEA. This is again, the only legislation that is works at the intersections of race, gender, sexual orientation, gender identity. There are policies, smart bold policies in that bill that address data collection, culturally responsive healthcare. We talked about making sure that there's a healthcare system that's culturally responsive and appropriate. There's language in there that would do that. So I would say support this piece of legislation. And number three, the Senate is exploring or taking up a relief package on coronavirus relief. So making sure that that package is inclusive of all the important needs that we've raised during this call. So definitely work and conduct outreach to your representatives and encourage them to take immediate action at the Senate level to pass the HEROES Act, for example, that would provide immediate leave to our communities.
Alberto. Representative?
I think I would add to run for office. If you want to create change and be a voice and run for office, at any state, at any level of government, we need more people of color. We need more LGBTQ people of color at the table to be a voice for communities that are underrepresented in government. And don't be too scared to run for office. I did it and I won.
Thank you. And Bambi, what would be your
yes, so my speech elevator or elevator speech. So I would say for the young, beautiful, and amazing, and energetic, and enthusiastic people who are here with all of us, I would say for you to understand the power that you hold individually, but also collectively. I would say not to give up on yourself, not to give up on your community, but be truthful to not just yourself, but also our community. We need to learn to, again, mean what we say and say what we mean. And if we really believe in social justice, and if we understand what the true liberation that we're all seeking means, if we all walk together to the finish line, we are going to accomplish that. But it's going to take a collective effort, and it's going to take an intergenerational effort. All us, and I'm saying us because I'm 50 years old, and some people consider me an elder who have been doing this work for a long time. We don't know everything, and you know a lot that we don't know. But we know some things that you may not know. And so if we unite and we walk together to the finish line, we are going to change the landscape of our peoples. So I invite you to be intentional on the work that you're doing and really understand and honor your power and your ancestors.
Thank you. No, what a great way to end this conversation. Thank you, Bambi. Thank you, Representative Gonzalez and Alberto, for this timely conversation. On really how we can address the issues impacting the Latinx community, and also how we can continue to support our LGBTQ siblings. I know I learned a great deal from this conversation alone and from each and every one of you. I also just want to quickly, just in terms of wrapping up, thank CHCI, thank the amazing CHCI Alumni Association who really came to the organization who wanted this conversation to happen, and for bringing us together this evening. I also want to invite you really quickly to check out CHCI alumni Jose Plaza's article, Pride, a Reminder of Struggle and Celebration, which we posted here on the chat box, which is a LinkedIn link he had created. Thank you for this thought-provoking piece, Jose. And also don't forget to fill out our post-webinar survey and let us know what you thought. Your feedback will help us to inform our future virtual events. Thank you all again. Thank you to our esteemed panelists and happy Pride. Muchas gracias.